Hi, I'm Dr. Greg Tchejeyan. I am the owner and chief orthopedic surgeon at Tchejeyan Orthopedics and Sports Medicine. Today we're going to be discussing what to expect before, during, and after your joint replacement procedure. We have a lot of protocols in place, the first of which is to ask you several times left or right. We all clearly know which side it is, however we have a protocol. So the nurses, the anesthesiologist, myself, we're all going to ask you left or right, and then I'm going to mark my initials on your limb. That will confirm it's the correct side. There are several protocols established in hip and knee replacement surgery to prevent infection. The first of which is to use a body soap for 5 days prior to the operation to decrease the bacteria count on your skin. In addition to that, we will ask you to change the linens and towels that you use prior to the operation. Once you arrive at the hospital, they will do a preoperative prep in the holding area, and then when you go into the operating room, we do a formal betadine prep. In addition to that, we'll be giving you antibiotics before the surgery and 2 doses after the operation. We do this in a specialized operating room that's called laminar flow. This is the kind of flow that pushes the bacteria away from the site of the infection to decrease the bacteria count. In addition to that, the hospital that we use, Thousand Oaks Surgical Hospital, is a hospital dedicated to people who are healthy. There's not sick people there, and therefore you'll have a decreased chance for getting an infection. I've done this surgery now for 20 years, and I have a dedicated surgical team that I use. My surgical team and I are efficient at doing this operation. We don't have strangers in the operating room, it's just our team. As a result, we are very efficient at doing this operation. Generally, we would perform hip and knee replacement surgery in less than 1 hour. When the surgery is performed in a shorter period of time, your infection rate is lower. If a person had a 3-hour operation, their infection rate would be higher than a person who had a 1-hour operation. When we do a knee replacement surgery, we use a bonding agent to bond the device to the skeleton. That bonding device has antibiotic in it. This also decreases your chance for getting an infection. At the end of the operation, we apply a medicated dressing to your surgical site. That medication is going to allow the infection rate to be lower. It's standard of care to use an anticoagulant after hip or knee replacement surgery. Generally, we use aspirin. If a person has an allergy to aspirin or has had history of blood clots in the past, we would use potentially a more powerful anticoagulation. We also use something called a TED hose, which is like a compression stocking, and something called the sequential compression device, or SCD. This circulates the blood through the calf as you're laying in bed. And we also are quick to mobilize patients after surgery, meaning we get you out of bed right away. This will all decrease the chance for getting a blood clot. Generally, the operation is done with a spinal block. This is the safest for you. It decreases the amount of bleeding during the operation, it decreases the risk for getting a blood clot, and it keeps the blood pressure low during the operation. In addition to that, you will be in a twilight. They will give you some sedation so that you don't remember anything during this period of time. The spinal block lasts approximately 3 hours. The operation is only about 1 hour, so you'll have plenty of coverage during the procedure. You won't feel or remember anything. After the surgery is completed, you'll come into the recovery room. The spinal block that's been given to you will last approximately 3 hours, and the operation is generally about 1 hour. So you will still have some numbness in your legs after the operation. That's completely normal. That's just from the spinal block. At about 2 hours after the operation, you'll arrive up on the second floor where you will have your post-operative recovery. This is a private hospital room. This is where the nurses will be coming to take care of you. And because the implants are now modern age implants, and they're state-of-the-art, we are able to facilitate you getting up that same day. So that day you will be getting up with physical therapy, walking, say, several hundred feet in the first day. Normally the hospital stay after hip or knee replacement surgery is 1 to 2 days. Upon discharge from the hospital, we always arrange for you to have a home physical therapy agency. They will provide physical therapy in your home. At the 2-week visit, you'll come see me in the office. We'll check your incision. If there's stitches, we'll have to take those out. We'll get an x-ray, make sure everything is recovering properly. And then we will transition you having a home-based physical therapy to an outpatient physical therapy. With a hip or knee replacement, I generally tell people it takes about 3 months to get 80% of the recovery after the joint replacement operation. However, it takes about 1 year to get full recovery, but between month 4 to month 12, it's just going to come on its own. So basically, at the end of 3 months, most people are very active, they're able to go on their vacations, they're able to integrate back into their normal lifestyle and resume most normal activities. However, you will gain full improvement for up to 1 year. What's important to remember is that your knee took many years or your hip took many years to degenerate, and the surgery is performed in a brief setting, so it will take some time for your body to adjust to the new device. Modern day hip and knee replacement surgery lasts 30 years. I've been doing this 20 years and I've never had to go back in on somebody's knee to change out the parts because they wore them out. If you follow these steps, you should have a more comfortable experience before and after surgery and into your recovery. Thanks for watching. And if you want to find out more about joint health, check out our other videos on my channel.